The team at the blood bank section of the country's referral hospital gathered to call for volunteers for these life-saving cause. The chairman for the blood transfusion committee at the Port Moresby General Hospital, Dr. Carl Kingston, said there is a need for blood at the hospital as the current ratio is 1 blood bag is to 7 patients.
And on any given day, there may be on average 7 people asking for 1 bag of blood. So that gives us a big challenge.
He said in a year they collect a total of 9,000 plus blood bags. However, for this year they have seen a small increase up to 12,000. Nevertheless, the number has reduced after final checks by the lab scientist. One of the lab scientists for the hospital, Phyllis Ivarato, said the amount of blood collected does not measure the demand the hospital has to meet, as they collect 30 bags per day, while there are demands for 100 plus per day.
84 bags per day needed, while we can only have 25 bags available. So the ratio stands at about 1:7. So 1 bag, 7 people are racing for 1 bag, you see. So it's like that. But really, in the lab, we work really hard to work with the demand. We have our criteria, we have our priorities. We look at mostly the blood bags used from the surgical wards and emergency department, because we have actively bleeding patients coming in. Equally as how our mothers are needing the blood.
She said that they cannot manufacture blood nor find it elsewhere, apart from blood donation by general public. The assistant nurse unit manager for blood bank, Sister Juliet Kwesaho, said they are currently using a donor recruitment criteria by World Health Organization and the hospital.
Blood donors, so that we have people who are well prepared, they take care of themselves, they rest well, and they don't have they're prepared for blood donation. So when they come in, we take them through and they donate, and they're able to help people more.
Dr. Kingston is now calling on government departments and other organizations like church groups to work together with them to help save lives, as 1 person can donate to save 3 lives.
That a very important group of people are the public service. And we would like to reach out to the heads of the public service, including all the departmental heads for all the public service. We want to establish regular donations at where the public servants are. If we can, like the private sector, incorporate blood donation as part of their corporate values, if we can build those into the corporate values of the departments, then we'll be able to have regular donations coming from a different department.
Samantha Solomon, National EMTV News.